thank you for joining us. And as I said, I'm Pete. I'm the activation manager for We Are Undefeatable. We've got Charlotte Pickles with us, who is a public health specialist from Blackburn with Darwen Council, and Alison Whittaker-Stewart, who's the physical activity campaigns lead for Together an Active Future. So the idea of today is that we'll be sharing our learning from our approach to our localised We Are Undefeatable campaign in Blackburn with Darwen. And really then we can hopefully share that learning so you can take any key tips, bits that you might want to take away that you can then build your own campaigns for specific audiences. And some of the things that we'll be covering is how we've used data-driven insights to tailor the campaign for local needs, how we've been fostering partnerships with a diverse range of stakeholders to broaden the impact in particular around accessibility and inclusivity. And also how you may be able to apply some of these valuable lessons that we've learned into your own initiatives that you may want to do to ultimately support people living with long-term health conditions to be active. So for those of you that aren't aware, as a national campaign, We're Undefeatable is a movement that's supporting people with long-term health conditions, which is developed by 15 health and social care charities that you can see on the screen there. The aim of We're Undefeatable is to provide inspiration through lived experiences of people living with those long-term health conditions and how they find their way to move. And we've been working with partners and stakeholders. Some of you I've engaged with on this call around a similar theme about how to localise We're Undefeatable so that local systems can utilise it and create a movement for change at place. So as a national campaign, we're insight-led to ensure that we resonate to a range of audiences across England. The campaign utilises research and data to create key hooks and messaging for campaign moments. And we also add to the body of research in this space to support our policy and influencing work, both nationally and within local systems too. And today, the key focus is how we've utilised public health data to drive our local We're Undefeatable in Blackburn with Darwen campaign. But first of all, I wanted to share nationally how We're Undefeatable is helping to change the narrative for people with long-term conditions. A little bit about the why, really. Why would we want to get involved with We're Undefeatable as a local area or a place? So we know that the campaign's really relatable to people living with long-term health conditions. 88% say it shows that people with a health condition can do physical activity. 85% say it shows how doing more physical activity can enable people to enjoy life in more ways. So not just focusing on the physical fitness and benefits around that, but actually all of the different parameters and benefits of moving more, whether that's social, whether that's mental benefits, whatever those may be. We know that it helps people to think differently about what counts as exercise, which is positive. And also we know that a large proportion take action as a result of seeing the campaign. So these are all of the reasons that we ultimately wanted to bring We're Undefeatable to Blackburn with Darwen and hopefully have a similar impact at place. So without further ado, the best way to show you what We're Undefeatable is all about is to share one of our campaign videos, and in particular, one of our local campaign stories. And this is Ralph's story that you're going to see and hear next, who has been our highest performing story across our channel so far. So here's Ralph. There you go. So there's Ralph's story. And as you can tell, you can see that he's Blackburn with Darwen through and through, and a storyteller who's living with multiple long-term health conditions, but also lives with a visual impairment as well. So a great way through the power of storytelling to reach a range of different people. Who may be able to relate to Ralph and Ralph's story in particular. And what's been really positive with Ralph's story and many of our others is that it also showcases the local stakeholders, and in this particular video, the swimming pool that Ralph goes to, and allows them to get behind and support the campaign too. And just before I hand over to Charlotte, at this stage, it's just important to note that our work in Blackburn with Darwen is a really fantastic example of localising the national campaign. But there are many ways that organisations, professionals and partners can utilise and embed We Are Undefeatable. And I'll come to that just at the very end, just in terms of if anyone wants to reach out and find out a little bit more about how you could do something similar in your area, because we know that there's so many variations to what can make something like this be achieved at place. So I'm going to now hand over to Charlotte Pickles, and she's going to talk through using public health data to tackle inequalities.
Thanks, Pete. Hi, everybody. Yeah, I'm Charlotte Pickles, Public Health Specialist at Blackburn with Darwen Borough Council, and I'm just going to sort of share a little bit about the demographics of Blackburn with Darwen for the lots of people on the call who won't know anything about Blackburn with Darwen. So we're going to share a little bit about kind of some of our core challenges within the area, and then how we really got in touch with the We Are Undefeatable campaign and how it all began, really. And then I'll be handing over to my colleague from TAF, who'll be supporting, sort of sharing more about that sort of data drive from a local level. If we can have the first slide, Pete. Thank you. So we continue to be one of the most deprived local authorities in England. Health residents lag behind the England average on a range of indicators, and this includes premature mortality from cardiovascular disease. We've got the highest rates of diabetes in the Northwest. We have higher than national averages of dementia and severe mental illness, and we also have higher rates of economic inactivity. As a result of people living with long-term health conditions, and also people who are unemployed because due to caring responsibilities. We have a lower life expectancy rate across the borough than national levels as well. So it's quite an interesting area. So we've got a lot of challenge, but on the right hand side you can see a map of Blackburn with Darwen and those areas where you see the highest levels of deprivation, but also some of the least deprived areas in our Darwen and more rural areas as well. So we've got a real mixed demographic. We also have a mixed ethnic background groups of people who live within the borough as well. So we have a large number of residents who are of South Asian heritage, and a growing number from Eastern European residents, as well as we have a lot of refugees and asylum seekers coming into the borough as well. So we have a real mix of people and demographics and geography, and we kind of have a bit of a challenge with that. But one of the key things, obviously, from a public health perspective, is thinking, how do we start to reduce some of those health inequalities, and what can we do to support better health outcomes for all across our population? So we can move on to the next slide, please, Pete. One of the key things that most people on this call will be very passionate about is how important physical activity is in supporting people to have better quality of life, especially those living with long-term health conditions. Actually can be really, really helpful to be moving in whichever way that they can, and that's very much why we came on board with the We Are Undefeatable campaign. But you can see here that, again, we've kind of, from the previous slide, we've got a lot of challenge around health outcomes, and then from here you can see we also have a lot of inactive adults, and you can see sort of the green line is the England average, so the solid line at the top is showing activity levels, and we are below England average activity levels, and in terms of inactivity we have a higher number, so 30% of adults are estimated to be physically inactive in the borough as well. So we know we've got a challenge around physical activity, and that's sort of high level data, but actually we also know from a local level, working very closely with our VCFSC organisations, that there's a challenge around accessibility and people's understanding about levels of activity as well, and the positive impact that can be elicited from being active. Thanks, Pete. So locally, we have, as you will all have your own strategies within your own areas. Ours is our sort of physical activity and food strategy is called Eat Well, Move More. And we have 5 core work streams underneath that strategy. And we've been working really hard over the last year or year and a half really to think about an implementation plan across each of those core work streams. And very quickly we could start to see that actually a project like this would fit really well within our active environments work stream, also around supporting our workforce, so thinking about those people that trying to keep people within the workforce, and how physical activity can support people to stay active and in the working. And also our core workforce around reducing, work stream around reducing health inequalities. And actually that's where it first started, and it sort of has grown from there for us. But it was very much our core objective to identify and work with targeted communities to reduce the risk of long-term conditions related to inactivity. And it was by chance really that I was on a webinar where Pete was presenting about We Are Undefeatable, and so was my colleague who is our local representative for TAF, and we both came together and said, wow, this is exactly what we need for Blackburn with Darwen. This could really work for our residents in terms of really speaking to people, local people, about the benefits of physical activity. Thanks, Pete. So we went about thinking, okay, we need to gather some interest around this if we're going to try and move this forward. And I think there was quite a lot of things all happening at the same time, which was really helpful for us. And I know that Alison, my colleague, will be talking about that as well. But one of the things that I could do from my role was to start floating this around the various sort of strategic groups and board meetings where people to garner an interest. So we have our strategic group for the Eat Well, Move More strategy, who obviously was straight away, yep, this fits for us. Our place-based partnership board, so really bringing in our wider place-based colleagues, ICB, and making sure that they were on board with this as well. Our Age Well board, the exec board, health and wellbeing board, these are all boards that you will also have in your local areas. But our Learning Disability and Autism Partnership Board and SEND Board, and we had an absolutely unanimous yes, we absolutely want to get behind this. We were able to show some of the national resources, and we really wanted to say, look, we want to be able to speak to people across our local area, in whichever ward they are in, to be able to really relate to this project as a piece of work that they can be engaged with. We're speaking to them. And we're talking about sort of local opportunities to be more active and the support that is around those people to engage with those services as well. So at that point, I'm going to hand over to my colleague Alison, who's going to go through a little bit more about how the next steps of the project.
Hi everyone, my name's Alison Whittaker-Stewart. I'm the Physical Activity Campaigns Lead for Together an Active Future, also known as TAF. We are one of Sport England's place-based partners. So there's 5 key ingredients really to this campaign in Blackburn with Darwen. First of all, we wanted to use real life stories of local residents. We wanted to signpost to local physical activity organisations and services. We wanted to involve everyone. We didn't want this campaign to be a council thing. We wanted everyone across Blackburn with Darwen, all different sectors, to get involved and to own it. We wanted to make our comms and marketing as inclusive as possible, and we wanted to be based on evidence and data of our local population. So we identified our priority audiences using a range of different data. In preparation for one of our initial meetings, Peter created a list using data from Joint Strategic Needs Assessment, which identifies local health and social care needs by gathering information from lots of different sources. Using this, and coupled with the information Charlotte provided from Public Health and also the Sport England Active Lives data, we understood which long-term health conditions are represented by the 15 different We Are Undefeatable charity partners are a priority for Blackburn with Darwen, and who we needed to find storytellers for. So in Blackburn with Darwen, our most prevalent long-term health conditions are diabetes, mental health, cancer, heart and respiratory conditions. One of the first campaign storytellers I had the pleasure to meet was Bob, this gentleman photoed on his electric bike. Bob lives with a heart condition and stays active on his bike. He also volunteers for the Refresh programme. My gut feeling told me that Bob's story would not be relatable for everybody in the borough, particularly those living in the most deprived wards. Those people probably would never be able to afford to ride an electric bike. I knew that gut instincts wouldn't be the only approach when designing a campaign like this, and I felt we needed more evidence to support our understanding of the borough, the individual wards, to enable us to shape the campaign more effectively. At the time, I was regularly attending the Blackburn with Darwen Comms Insights and Engagement meeting organised by the ICB. This proved really beneficial. Informing the group of the forthcoming campaign and the potential challenges we were facing opened up new avenues of opportunity. Following one of the meetings, the Chief Executive of Healthwatch Blackburn with Darwen generously shared profiles for every ward in the borough. These provided qualitative insights and deepened our understanding of some of the challenges residents faced. Additionally, the Council's Public Health data analysis supplied us with a comprehensive spreadsheet from the Aristotle system and met with us to explain the data. If your council doesn't have a public health team, try asking someone in the local NHS business intelligence team to support you or access something called fingertips. We simplified all of this data and insight to support us with the campaign delivery. We created a RAG table that prioritised wards, the most long-term health conditions which were most prevalent in those wards, demographic information, and then match those with the different storytellers. So as you can see from this slide, in the top corner, there were lots of colours. That was the spreadsheet provided by the public health data analyst with all the qualitative information, and we created it into a really simple table. This table was shared with the agency to determine which story to prioritise. It helped determine which bus stops were used out of the 120 available and which storytellers would resonate most in the different areas. It ultimately made our campaign more relatable and successful. It also helped to identify gaps in our storytellers. So we delivered the campaign in lots of different ways. So out-of-home advertising, next slide please, was one of the big ways we really pushed the campaign. Blackburn with Darwen is really quite fortunate to have a lot of screens. We have 2 large digital screens in the town centres. We have some in the railway and the bus stations, and most of the bus shelters are owned by the council. We're very fortunate because we didn't have to pay commercial advertising rates to really promote this campaign across the borough. Not all the storytellers were put on all the different bus stops across the borough. We looked at our back of our RAG table and worked out, okay, this ward, this story will resonate more in this ward because those long-term health conditions or the demographics or and such like. So we were very, very strategic in which storytellers were placed on which advertising opportunity. I also spent a lot of time with the advertising team and a local charity chief executive who had a background in out-of-home advertising to learn which bus shelters across the Blackburn with Darwen were the best, or are the best, should I say. We also advertised on a newly erected private-owned screen in Darwen, and it was well worth it because they created their own social media posts around working with us and advertised which stories were all Darwen residents, etc. Peter will touch on this later, but because we put so much thought into our paid-for advertising, it meant the messages were really resonating with the target audience, the videos were being watched, and consequently, our advertising spend was really low. In addition to this, we also used printed publications. Our local newspaper, the Lancashire Telegraph, picked up on the campaign, and the health reporter did a great job on including more information about the condition than was available on our story page on the website. Interestingly, the stories that they featured the first were Usman's, Michelle's, Sima, and Nina. We also paid for advertorials in the One Voice magazine. One Voice is a Blackburn-based charity which supports the Southeast Asian community and produces a quarterly magazine which is distributed to 14,000 households. They also introduced me to Usman and Saima. The Chief Executive provided me with invaluable insight into which stories to feature. By spending time with them and really listening to them, I learned so much more. I learned that strokes amongst young people in that community are becoming more increasingly common, but they're not talked about. And he asked me if we could include Zoe's story in the advertorials to raise awareness that strokes do happen amongst young people as well. So in addition to lots of the public health data, we also used a lot of insight from local people and local charities in the borough. We also used posters. Initially, we were planning on being digital only, and we, on the campaign pack on the website, all the posters for all the storytellers are available to download. But what we noticed were they weren't being downloaded as much as we would like. And because people don't always have printing facilities, so we chose to professionally print a selection of them and display them in all council-owned properties, leisure centres, family hubs, libraries, etc. I also hand-delivered posters along with moving medicine packs to all GP surgeries in the borough. Because they looked so good, they were there, they just went straight up on the wall. It removed any barriers to displaying them. The QR code on the poster not only takes people directly to the relevant story on the website, but is very important in terms of making sure the content is more accessible to different communities. Social media. This was a big part of the campaign. We did pay for advertising on 3 different accounts: Blackburn with Darwen Council, Blackburn with Darwen Leisure, and The Refresh. We used 4 different platforms: Facebook, X, YouTube, and Instagram. Next slide, please, Peter. This lady, Saima, one of our storytellers, I've learned a lot from this lady. Saima informed me that people in the Southeast Asian community in Blackburn with Darwen prefer to use WhatsApp, TikTok, and Instagram Reels, as the content doesn't stay up or as visible for as long. As a consequence of learning this as we were progressing through the campaign, we created 1-by-1 videos and some reels, which Saima and others were happy to share from their own personal social media accounts. Next slide. All the stories are featured on the Blackburn with Darwen Public Health website, which is called Be Well. We'll put a link in the chat for you. And Peter's just going to, there's a little video of what the web page looks like. So each story has its own tile, and then you can click on the read the story to view a video. So there's the video, roll subtitles, there's a story. And as we progress down, you'll see links to the different organisations that are mentioned in the story. So you can download the poster. There's reference to Blackburn Rovers Community Trust, Age UK, Alzheimer's Society, and such like. Now, there is a question in the chat of how did we get some of the storytellers? Well, as a whole, there wasn't one size fits all, to be honest. A lot of the different physical activity providers in Blackburn with Darwen suggested and recommended people who access their services who might be willing to be a storyteller. So quite a few of them came through partners, and consequently the partners have then shared their stories. Others were referred through the wellbeing service and the refresh service. Others we knew of people in just different connections. So yeah, there wasn't one size fits all, but they all came through local partners one way or another. So as you can also see from that web page, it signposts the wellbeing service. So if somebody is inspired by reading or watching the story but really unsure what next steps to take, they can get in touch with the wellbeing service there. This presence of this campaign on the public health website has hugely increased traffic. It's been really beneficial for the public health website. Also on the website is a campaign pack. The campaign pack has been developed for all partners to use. Sport England encourage place-based partners to share learning. We know not everyone has the resource and capacity to create the assets as we have done, and that's why we wanted to create all the assets for everyone to use. There's a social media toolkit on there with suggested messaging, and all the videos we've created don't have any reference to Blackburn with Darwen in. There's no council logo on there. We want you to be able to use them, share them far and wide. So a number of partners have been absolutely amazing. If you can just go back, please. So the 180 project, for example, have shared Michelle's story. Blackburn Rovers have really got behind the campaign and supported it in many ways. So we had, Glyn was one of our storytellers who attends Blackburn Rovers walking football sessions. And then Blackburn Rovers asked if there was anyone else who was connected to the club in any way. Now, I knew that Bob was a lifelong supporter and season ticket holder. So I introduced them. Bob went down. Blackburn Rovers did a whole 7-minute video, which documented more of Bob's story than we did. And they shared it to coincide with World Heart Day. I've absolutely no doubt that by his story being shared by Rovers and having the stadium in the background, it will have caught more attention and interest of a large number of the target audience who might not have seen our story otherwise. Next slide. We've also connected to various number of national charities, and Peter has played an absolutely instrumental role in raising the awareness of the campaign amongst national partners, a number of whom are on this call today. So once our assets were created, Peter shared the relevant ones to the appropriate person in the national charities, and they've all got involved in different ways. So Parkinson's attended our launch event, British Heart Foundation shared Bob's story on social media. Simon's really excited to looking forward to working with breast cancer now on a campaign. Dillis's story has been in Mindsy newsletter. Dilwara's story has been shared by This Girl Can. And English Football League, who were also on this call today, wanted to share Glyn's story to coincide with World Alzheimer's Day. The EFL, Blackburn Rovers, We Are Undefeatable, Blackburn with Darwen Council came together to do an Instagram collab post. Sometimes collaboration can take a little bit longer, but working together certainly helps amplify this campaign's reach beyond any of our initial expectations. If I was to do this campaign again, I would identify and involve some key partners, perhaps a little bit earlier than when we did. Next. We've tried to make our content as inclusive and accessible as possible. So in Blackburn with Darwen, it's a relatively deprived borough, with some areas in the top 10 most deprived in the country. So most of our stories focus largely on being active in blue and green spaces and activities which are free or low cost. Our storytelling range from mid-30s to 80 and from a range of backgrounds. Accessibility. By making the videos accessible means the campaign has reached a much larger audience. This lady in the bottom, Simon's story. So Simon and Ralph are both visually impaired. We've had their stories audio transcribed. Because we've had them audio transcribed, we then made connections with RNIB, who gave us access to their closed Facebook group page in the Northwest, and we were able to share their videos on that platform. By working with the Deaf Village, we've half the videos are BSL transcribed, that British Sign Language, and they've uploaded the videos and put them onto their social media platforms as well. We're working really closely with them. Further to feedback from the Learning Disability Partnership Board, we're also in the process of creating read easy formats of all the stories, so they can be accessed with people with low literacy levels. And interestingly, through working and listening with local GPs, particularly those from the BME community, we're advised not to use AI to translate videos, as the regional accents can vary widely. We're also informed not to include Arabic subtitles, as people who are unable to read English are probably unlikely to read Arabic too. So that's the end of my section. I'll hand over to Peter to talk about how we've used data in other ways.
Thank you, Alison. There is another question in the chat, but we'll come to that one because it's a really good one, and we are going to talk through a little bit of the initial campaign impact shortly. But you've just heard about all of the ways that we've utilised local data and how that's really informed our approach in Blackburn with Darwen. But we also utilise national data to inform the local campaign as well. So we focused on our We're Undefeatable Bridging the Gap report, and the data from that to help us shape a lot of the work that Alison touched upon earlier when we've been engaging with GPs, with healthcare professionals across the borough. So you can see that the NHS, healthcare professionals and a person's GP are still the most trusted sources of physical activity advice for people living with long-term health conditions. And that's something that, as well as delivering the local We're Undefeatable campaign, we also wanted to build upon that and connect with supporting the workforce as part of the wider Eat Well, Move More strategy that Charlotte touched upon earlier, in encouraging healthcare professionals locally to get behind this type of message and to have conversations with people living with long-term health conditions, backed then by the comms and the messaging that came through the posters that were in those practices. And again, it takes time to build those relationships. We have, through the council's public health team, we're really lucky to attend primary care network meetings across, I think it's 5 in Blackburn with Darwen, could be 4, Charlotte can correct me on that. And we attended those to raise awareness of the campaign and how people can get behind it. And alongside that, then, as Alison mentioned, and knowing the national data, it led us to creating these moving medicine resource packs that were given out at our launch event and also hand delivered to GP surgeries across the borough. And our initial feedback is that they were really well received, and many healthcare professionals were not previously aware of the resource and had the opportunity to connect with that. So again, a great approach of how we can sort of support the public in inspiring them to be active, but also then aligning with physical activity and long-term health conditions across other areas of work as we integrate across the local ecosystem, and in this case across the health and social care system. So what we're going to move on to for these last little bits is just the campaign impact so far, and it's important to say so far because the main parts of the campaign launched over summer to sort of early autumn last year, and we're still evaluating some of that, so we may not have all of the answers now, but that's one of the big next steps, is that we're currently surveying the public perceptions, doing interviews and surveying for local stakeholders as well to get their reaction to the campaign, what they've thought about it. And so far the reaction has been really positive and similar to our national results, but the aim will be in the next couple of months to pull all of that together in a really handy evaluation report, but also learning report and a bit of a case study that then we can share this with people on this call and others who may be interested in localizing a campaign in their area. But what we do have, and these stats as of the end of October, is a digital impact report, and some of the highlights we've pulled on the screen here. So you can see on the right hand side the top 5 most watched videos, and those views are ever increasing as we continue to promote the campaign across organic channels. But we know that it's had lots of watch time. As Alison mentioned earlier, the campaign's increased the traffic to the public health landing page by nearly 2,000% in just that 5-month period. We've had strong completion rates, meaning that the videos are engaging and resonating well with the target audience. And also the ads are generating views at a low cost, which is maximising the budget that we had attributed to that. So quite a low cost per view, which was great to see. And I guess what we're going to try and do in the impact report is pull together some of these campaign metrics and digital insights, but then also have the contextual learning that we're going to get from the public perception and what our stakeholders have been involved with and engaged with too. So I'm going to quickly hand back over to Charlotte, who's going to talk about next steps, and then we're going to wrap up and come in for questions.
Thanks, Pete. Yes, I think it's just a very quick one back to me, just to sort of where we've got to and where we're hoping to go to as well. So as Pete just said, the evaluation is underway at the moment. We're looking at those perceptions from professionals' perspective as well as the public, holding stakeholder interviews, and the evaluation report will come through. So that will really bring together a lot of that all of that data insight. But I think for us, it's what has this campaign encouraged people, motivated people who were living with long-term conditions to become more active, and how do we capture some of that, and how do we take that forward as well? So thinking about, we're wanting to work with our current storytellers and making sure that they feel that they've understand the impact that they've had in terms of our journey, which has been huge for us, both sort of locally and regionally, nationally. Get the the exposure it's had has been more than we'd ever anticipated, but we want to make sure that they continue to carry on their journey with us if they choose to, and also thinking about future storytellers, those people who can support in terms of sort of more peer support and those voices of encouraging others to come on board with being physically active, and making sure that we're really engaging with all of our local providers, and it's really helped us. Actually, it's another sort of outcome has been that it's really supported that partnership working. I feel like it's given us a bit of an anchor to bring people together to carry these conversations forward in perhaps different spaces where they haven't happened before as well. Definitely cementing our connections across mental health services, and those providers too, thinking about the benefits of physical activity, not just for long-term conditions, but thinking about mental health and well-being on an everyday basis as well. So we're wanting to continue with this, really keeping up the momentum around the campaign, but making sure that we're localising it and bringing it back to, it will be driven by our local health and wellbeing service going forward. So again, connecting into TAF and really sort of thinking about how do we make sure that we don't lose what we've created. We've had engagement with members of Parliament. I know Pete's been driving that forward, and we've been thinking about our own local councillors as well, and speaking to those and obviously our exec members within the council as well, making sure that everybody's on board and understands. And again, it isn't a hard sell, because it's kind of the resources speak for themselves. We've got some fantastic stories, and the graphics, just people totally understand what it is that we're trying to achieve. So yeah, so that's kind of where we're at. We're bringing it back to thinking, okay, how do we've started small, we've gone big, it's how do we bring it back down to something that is really meaningful for us in Blackburn and Darwen and makes that difference where it counts. Thanks, Pete.
Thank you very much. And yeah, there's a couple of bits in the chat around the campaign pack, so we'll have to look into that. It might just be an accessibility issue related to, I guess, what your organisation allows. I guess one way around it may be forwarding it to another email address that you may have, but we'll have a think about that in the follow-up and see if there's another way that we can get some of the assets over to you. It'll be hard to send them over email because they're such large files, as you can imagine. And then there's a question also from Andrew about, have you done or planning to do any evaluation on the impact on the NHS, for example, reduction in GP appointments? We are currently out surveying local stakeholders, and we're encouraging the local health and social care networks and organisations to share their feedback on that. So we may start to see some of the insights coming through around the impact that it's having. I guess one thing that's probably clear just from some anecdotal insights is that it can be quite a slow burner. We have had really good engagement with the hospital trust, for example, who are looking to use some of the resources. But for them, they've made it clear that it might take a little bit more time for them to actually implement this within the work that they're doing. They're linked in with some of the active hospitals work, which aligns with moving medicine, and they're just currently scoping that out. So I guess that'll be part of our drumbeat of comms for 2025, is how we can continue to work with stakeholders, including the NHS, to implement this and then see an impact. So it might be something that will be further down the line where we can sort of report on some of that. But hopefully we'll get some reflections from the stakeholders who are involved in the campaign. So in terms of getting involved, and then we'll come to some of the questions. We're seeing more come in the chat now, which is fantastic. What I wanted to touch on really quickly is there's a free way that the national campaign has created a resource where you can now create your own We Are Undefeatable assets. It's basically a template. You can change the imagery, so you can see John on the right hand side is, I guess, the example one. This template is all about signposting to a service that you may have. So I've just mocked this up using one of the partner logos from our Community Leisure UK work, but also just made up this physical activity referral scheme example here. But this could be any activity that you or your local partners are delivering to signpost people and utilise the campaign assets to get to that. A lot of it can just be taken from a smartphone, and then you upload them to the templates, and then we have stories versions as well. So you can see the one on the left, which can share some ways that stories can go onto your comms channels, whether that's for social media or within newsletters. And the idea is it's a completely free way that you can sort of connect some of the stories from the services that you may be utilising, and then connect them in with the campaign, because we know that, I think there's a question about budget, which we'll come to shortly. And yeah, there's some people who will have budget aligned to this. Even in the conversations I've had in the last 6 months, has been really useful in understanding what's available for different places. And what we want to do is provide some resources that can get you involved and do that at a low, or if not no budget cost, because we know this Blackburn with Darwen example is a slightly different one to share with different places. And then just finally, we have our campaign hub. So if anybody is keen to find out more about the national assets and resources, then please do scan the QR code or visit the newly developed campaign hub, which is all for professionals who are supporting the campaign. And you can find all the different resources and assets that you can get involved with. But without further ado, what we will do is leave you with one more QR code, but you've already had the link to this in the chat, and this is just to our We're Undefeatable in Blackburn with Darwen campaign page, where you can see all of the different stories. Do go and have an explore if you've got some free time this afternoon. And if you are interested in finding out more about the local campaign, or how you can localise the campaign within your organisation or your work, then please do get in touch with us. But what we'll do now is come to some questions. We're going to stop the recording now as well, if that's okay, Leanne, and then we'll answer some in the chat in the first instance, and then we'll open it up to the floor for any questions.